Assalamu alaikum. Very good afternoon. A very, very warm welcome to each of our participants joining us today for the Health and You Community Wellness Series. I'm Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health here at Weill Cornell Medicine. And we would like to welcome each of you again for joining us today in this session. So as many of you may know who've joined this session before, this basically the overall goal of the series is really to create community awareness about health, and the ultimate objective will be to enhance self-care, reduce suffering, and improve the overall quality of life and increase healthy longevity. As a reminder, this is not a CME CPD activity. So there'll be no certificates of attendance for those people. I know people generally tend to ask us if they're going to be attendance certificates for this series. There is no attendance certificate. This is for the general public, and basically it's really to create health awareness. So your microphones and cameras have been turned off. We request that you use either the Q&A tab for questions and comments, or you could actually also just post your comments and questions in the chat feature. We will be able to see them. Questions will be addressed at the end of the session, and I will moderate the Q&A session. And as a reminder, again, this is not a CME CPD activity. So we have a really, really interesting topic for today, and I'm really excited, to be introducing our speaker for today. We have Dr. Salman al-Jerdi. So it's really my honor and privilege to introduce him. He's also an alumni of Weill Cornell Medicine-Qatar, so he's more special for us. So as an introduction, Dr. al-Jerdi, he's an assistant professor of neurology at Weill Cornell Medicine in Qatar, and he's also a consultant in the neurology and stroke department at Hamad Medical Corporation. He graduated from Weill Cornell Medicine Qatar in 2012, and then he moved to the United States for additional training. He completed his internship in internal medicine at the New York Medical College's Westchester Medical Center in 2013, and then his residency in neurology at the University of Vermont Medical Center in 2016. Afterwards, he also completed a vascular neurology fellowship at the University of Iowa Hospitals and Clinics in 2017. Throughout his time in the United States, he was heavily involved in medical student and resident education. In 2015, he was the recipient of the Arnold P. Gold Foundation Humanism and Excellence in Teaching Award. He has been a sub-investigator on multiple clinical trials, focused in particular on cluster headaches and cerebrovascular disease. Currently, his research interests focus on the management of ischemic stroke, medical education, and healthcare quality improvement. So Dr. Salman al-Jerdi, a very, very warm welcome to you, and over to you. I am really looking forward to how we can preserve our memory. Thank you so much, and over to you.
Thank you very, very much, Dr. Chima. Very kind introduction. And of course, it's my privilege to be with you here. I think this is my second time, and I always look forward to more in the future, inshallah, if you guys enjoy having me around. So, assalamu alaikum. Thank you very much, everyone. Really warm welcome, and Ramadan Kareem. Inshallah, I hope all of your fasts are going well. Inshallah, I'm going to spend some time today discussing a topic which is really very near and dear to my heart, something that I think a lot of us, particularly those who have elderly family members, really understand the impact of, which is memory loss. So we're going to focus on the memory loss really from the perspective of wellness, from mind wellness, and talk about insights on how to preserve memory. So let me begin with the typical disclosure slides. I receive no funding or any conflict of interest that particularly occurs for this particular topic. So for today, we're going to give a brief introduction about this topic, discuss what normal aging is, what is considered normal, and then discuss what is considered to be unhealthy brain aging, what is abnormal in that particular perspective. How do we recognize it? How do we make strategies to promote healthy brain aging? And then if there is memory loss that does happen, what are some things that we can do to treat it? So hopefully this will be a relatively comprehensive approach in a short period of time to discuss the topic of memory loss. So let's begin with the introduction. So a lot of the data about this comes from the United States. Many countries in the world report the data, but it's not as comprehensive. And unfortunately, there are some places that still don't report fully from the data. But what's happening in the US seems to be happening for the rest of the world. In the United States, the incidence of people who will develop Alzheimer's disease is actually 1 in every 5 women and 1 in every 10 men over the age of 65. We see that women will get it more, and that tends to be because women tend to live longer than men. And so the longer you live, the more likely you are to develop Alzheimer's disease. At the moment, there's actually about 6.5 million Americans around the world, and Americans and many, many more around the world who are actually living with Alzheimer's disease. And in the US, 133,000 people die from Alzheimer's disease every year. So it's a real significant population health burden that we see. If you look at the other side of this equation, and if many of you have relatives who have memory loss or any kind of disability, I think you recognize that the illness really doesn't only affect the patient, but it affects the family and the entire community. So we actually know that there are 12 million unpaid caregivers. This is almost double the number of patients who have Alzheimer's disease, who provide an estimated 15.5 billion hours of care. So this has a very significant impact on society, on economy, and it's something that we absolutely need to be aware of when discussing diseases of the central nervous system, of the brain, and particularly when it comes to memory. Here's a chart that's actually from the newsroom at the UCLA, which now discusses a more worldwide or global perspective. And so if you look at the year, we're just beyond 2020, we're seeing really approximately about 45 million people currently in the world who are living with Alzheimer's disease. This is not all types of memory loss. This is just Alzheimer's disease. The ones that are colored in the blue are the ones that are considered in the early stage. And the ones that are considered in the orange and red are those who have more advanced diseases or more advanced stages of Alzheimer's disease. So if you look at the numbers, you will see that we will actually more than double these numbers by 2050. And this is a very, very significant hazard. This has a very conservative estimate of 106 million. The data was obtained from estimates based on 2007 data. The current estimates are actually more than 150 million people by 2050 will have the disease. So of course, these are all estimates, but this is just to show that the burden of disease is very, very significant around the world. Now, when we're talking around the world, we should also look at where these patients exist. And it seems like dementia is actually increasing significantly in areas that have low and middle incomes compared to areas of high income. There are a lot of reasons why this is happening. One of them is related to the fact that people who are in high income countries are already living to longer years, but in the low and middle income countries, we expect that their life expectancy will actually continue to grow. The second reason is there's unfortunately a higher incidence of risk factors and a lack of access to proper healthcare in low and middle income countries generally. So unfortunately, we will expect to see an even higher hit to these countries and an even higher impact to the economies of countries that are already struggling. So I hope this is clear that it's a really, really significant issue. Now, this is a global map that looks at the number of patients that died from Alzheimer's disease in 2019. And as you can see, our part of the world, the Eastern Mediterranean, Western Asia, in Africa, there is a really high incidence of these numbers, indicating that unfortunately, our part of the world is significantly impacted by death related to Alzheimer's disease. So all the more reason why we should definitely pay attention and definitely try to do something about this. So inshallah, today will be a step in the right direction. So what is normal aging? You know, a lot of us think when people get old, it's normal to have memory loss or it's normal not to be able to do something or the other. I think it's really important to understand what normal aging is and what is the difference between that and abnormal aging. So normal aging is really dictated by different biological processes that we're not going to go through in detail today. But changes happen not just with the appearance of the patient, not just with the memory of the patient, but really at the level of cells, at the level of DNA damage that tends to accumulate over decades and decades of life when the body does not always succeed in correcting it. We know that there are changes in metabolism that happen. We know that there is a change in the way the body responds to stress. This is both emotional as well as physiological stress. And we know that there's changes in things like sleep. So all of these together are actually part of the normal aging process. And trying to control these is helpful, but it isn't necessarily a problem unless other things happen that we will talk about in a few minutes. So how do these molecular and cellular processes translate into normal aging when it comes to memory in particular? So we will notice that it's actually normal and very common for patients who become older to have a slightly harder time acquiring new information or learning new things. It takes them longer, and they have to try multiple times in order to learn new information. It also takes them a little bit longer to recall information. So if they've recently learned something new, it is actually quite common and very understandable for them to require some period of time to recall this information. Sometimes they have some difficulty with communication, particularly with naming things. If the names are older, you'll notice people saying, oh, I remember this gentleman, but I don't remember their name, or I don't remember the name of this device or vehicle. But it is very mild in order for it to be normal. It should be quite mild. And a lot of these patients will have less flexibility when it comes to their thinking. So they are used to doing things a certain way, and it's very difficult for them to change the way they do things and do them differently. But all of these are actually characteristics of normal aging. This is not something that we need to treat. This is not something that we need to fix. This is expected. But notice that memory loss, forgetfulness are actually not part of normal age. And we expect people to grow and get old and get to the end of their life and not really have significant memory problems. So if this is what normal aging looks like, how do we know if it's normal for everybody? Well, it turns out it's not. Even within the realm of normal, there are things that can affect it from one individual to the next. So things like education. If somebody has a lot of education, what's normal for them may be different from someone that has less education. If somebody is in great physical condition, it may be different than someone who is in poor physical condition, and so on. There's a lot of factors like living situation, socioeconomic status, and a lot of things that we know impacts what is considered normal for patients. But what's really important, and what I think we really need to talk about today, is what is not normal, what is considered unhealthy brain aging. So if the changes that we described, or if there are any other changes that interfere with the activities of daily living, this is considered abnormal. This is not normal. So if patients typically are able to care for themselves, eat on their own, change their clothes, use the restroom, shower, go out, manage their finances, and then all of a sudden they are not able to perform those things, this is considered to be abnormal. This is not part of the normal, healthy aging of the brain. The second thing is if these changes affect their quality of life. So all of a sudden, these patients have a really poor quality of life. This is not considered normal aging, and we should actually remove the stigma that older people generally have poor lives or poor quality of lives. They should continue to have an excellent quality of life, and that be maintained throughout their life. The third issue is if they have some changes, but these changes are not stable. They continue to progress over time and get worse and worse over time. So if you meet any of these criteria, if you see any change which is worsening or affecting quality of life or activities of daily living, we should consider this to be an abnormal change. Now, it's important to note that these patients will generally not notice these changes, particularly in the beginning, and that a lot of these changes are actually noticed by either their family members or friends or loved ones, sometimes their neighbors. And so it's very important when caring for these people to actually have what we call in medicine collateral history. Essentially, have the story be told by more than one person who knows the patient and who is able to describe what's going on. So how do we recognize it? if you're not going to a doctor's office and if you're not being asked questions, and more importantly, if you are the family member of a person and you're concerned that they may be experiencing some kind of memory loss, what are some signs that you should look for? So here's the first one. The first one is difficulty planning and carrying out tasks, especially familiar tasks. So if someone is not used to cooking and all of a sudden they don't know how to cook, this is not new for them. But if someone has been cooking for 50 years, 70 years, and all of a sudden the same meal that they have prepared over and over again, they have a hard time preparing. They don't understand how to bring the ingredients together, how to put them together, how long it should cook. This should be something which is very concerning to you. And this carries forward to everything, right? If people are handy and they know how to fix things around the house, and all of a sudden they don't know how to do that, things like driving, things like performing a sport activity, anything that someone is used to and now has a hard time planning the event and planning how to do it and actually delivering on doing it, that's as a concern. The second thing is if they have noticeable communication challenges. So they're not really able to describe to you what happened. They're not really able to tell you what they did during the daytime. They just really have a hard time communicating with you. Even if they can find words, but the content of their expressions is not as meaningful, this should be something that triggers your attention. If they have unexplained changes in mood, so all of a sudden they're sitting there, they become very sad or tearful, or maybe even laugh inappropriately, this can be a sign of a memory problem. Repeating questions, right? This is very common. We get a lot of questions about repeating questions. It should not be something that patients do regularly. So if you and your father or your grandmother discussed a particular topic, they should not be asking you about the same thing multiple times in the same day. That indicates that they are actually not able to recall or remember this information. The last point, I think, is a more subtle but very important point, which is a decrease in the initiative and interest in doing tasks. So you will see, for example, people who are in their 60s, they love going out, they love going to the park, to the mall, maybe go watch a movie or maybe go eat outside. All of a sudden, they're no longer initiating these activities. They don't want to do this anymore. They're very hesitant. If you invite them to go out, they say, no, it's okay. I'd rather just stay at home. I'm not interested. And this is not a one-time incident, obviously. This is something that has to be a theme. It has to kind of occur over a period of time. So these are signs that are very, very important to pay attention to when you are thinking about someone with memory loss or memory changes. So how do we try to avoid these things from happening? And this is something that I really want to focus on today. So what are the strategies that we use to promote healthy brain aging? And when do we begin? Do we begin when people experience memory problems, or do we begin, when people are 60 or when they're 70? When do we start? So I think the key is very simple. It's a very simple strategy where we have to increase the factors that help memory, and we have to lower the factors that affect memory. And it turns out these factors can actually begin as early as childhood. So the answer to the question, when do we employ these strategies? It is as early as possible because it protects us and it protects our loved ones from the burden of caring for someone with memory changes. So what are some of the factors that help memory? First and foremost, exercise. Exercise is heavily emphasized and has been described multiple times to have a really large impact when it comes to preventing memory loss. It's actually more effective than medication. So if there is one thing that you need to do after today, it's when you exercise, which of course I'm sure everyone is exercising, mashallah, you have to really emphasize to yourself that what you're actually doing is you're investing in your brain, you're investing in your memory, you're investing in your mind. And this investment will pay off in the future by preserving your memory and preserving your mental abilities. The second thing, if we look to the right side, is to eat a generally more plant-based, healthier diet. So increasing your consumption of vegetables, fruits, nuts, and really decreasing processed food intake. Again, it sounds really simple, but it can be very challenging in our busy lifestyles. So while very few of us can do this perfectly all the time, I think most of us can at least try to make on a daily basis a decision that maybe I can select a slightly better meal, or maybe I can cook something a little better, or maybe I can order something a little bit healthier. And over time, these changes really accumulate when it comes to effect. You'll notice the third one is continue to read and learn. So the brain, even though it's not a muscle, in a way it works like a muscle. If you use it, it grows, and if you lose it, if you don't use it, you lose it, essentially. So you want to continue to exercise not just your body, but your brain. So you continuing to read, continuing to learn new things, to learn new skills, to read about new topics. These things are actually very, very important, and they're very likely to help your memory and to help maintain your cognitive ability. The same as doing new activities. So if you've never tried swimming before, it's actually not a bad time, no matter how old you are, to just try to learn. Sometimes just getting in the water and moving your hands and having a new experience is actually very stimulating to your brain, and it can continue to promote your mind health and your brain health. Same with riding a bicycle, or even learning how to cook for the first time. I'm not an exceptional cook, so it's always a skill that I would like to work on and improve. Meeting new people. So there is a lot of increased research and data now talking about loneliness and the effects of loneliness. It's very easy in our lifestyles. We're very busy. We're in multiple places. We have to Zoom with people to just at the end of the day kind of be alone and try to be with ourselves. And while having good quality alone time is important, this crossing over into loneliness is a really big problem. And so maintaining people that are friends and colleagues that are next to you, but also meeting new people and engaging in new conversations is always very stimulating to your brain. Same thing with going to new places. You know, you can say, Salman told us it's important to travel, so we're going to take a vacation and travel. But really, I mean, it is true. Traveling, going to new places, even visiting new places in the same country that you live in. So, you know, we live in Qatar. We're very fortunate. It's really undergone a large change, and it's expanding, and there's always new places. And as someone who has been born here, there's places that I still haven't seen. So exploring new places is also stimulating, and it's something that we should focus on. So if you remember, we talked about increasing the things that affect, that improve your memory. But what about things that affect it or worsen the memory? These, of course, we have to work on decreasing. And the first one, I put one at the top of the list, is cardiovascular and metabolic diseases. These are very, very common, and they are actually increasing in the population, which is leading to an increase in the incidence of dementia and of memory loss. So watch your weight and make sure that you take high blood pressure, diabetes, and cholesterol very seriously. I see this very common in my clinic. You know, people who are in their 20s and 30s, they have high blood pressure, and they think because they're young, it has no impact on them, when in fact it may actually have a larger impact on them than it does on people who are older. So it's very important to monitor these things, and very important to address them and treat them very aggressively, and not just ignore them because of someone's age. The second thing is sleep disturbance. Of course, you know, we have all sorts of stressful things, and we have to wake up early and stay up late and things like this. But we know that good quality sleep, which is regular, is actually very helpful for your memory. And the loss of that can over time impact your memory. Things like stress or depression or other mental health issues have been clearly shown to also affect memory. So you can try things like meditation, positive thinking exercises, even just going for a walk or physical exercise will help. And please, I want to take this as an opportunity. Please seek help if needed. There is nothing to be ashamed of, and it's something that we all work together as a team, as a community, in order to achieve better things for all of us. Hearing loss. So, of course, hearing loss tends to happen as we get older, and it's very important to check and treat for hearing loss because people who lose hearing become socially isolated, even if they are sitting and they're engaging in conversations with everyone else. And in order to prevent that in your younger years, try to decrease background noise wherever you are, and try to reduce your exposure to loud noises. Of course, all of these will have an impact long term. Any kind of unhealthy intake, smoking, alcohol, substance abuse, all of this stuff tends to have an impact long term. And so, of course, as with any medical condition, we strongly discourage anyone from being exposed to these substances. Physical pain. So we know that people who are older tend to have a higher incidence of pain, back pain, neck pain, knee pain, shoulder pain, really any kind of pain. If it goes on for a long period of time, it can affect your memory. And the brain dealing with pain is not the most pleasant thing for it. And the resources that it uses up to tolerate and deal with the pain can actually be used for better sustenance of the brain. So I strongly recommend, if you're experiencing pain, to seek medical attention and to treat that pain appropriately, of course. And then finally, things like brain injury. So brain injury can happen at any age, obviously. It actually tends to happen quite common in people who are younger because they get into accidents, and then people who are a lot older because they experience falls. So it's very important to be careful, pay attention, wear protective equipment. If you're on a bike, put a helmet on, make sure you always wear your seatbelt. All of this stuff will actually make a difference long term when it comes to memory impact. So if you've done all these things, or if we start to all of a sudden notice that there are some changes that are happening in memory, you can notice this to yourself, God forbid, or to a loved one. What can we do to treat this memory loss? And what can we do to prevent it from becoming worse? And I think what I would like to emphasize is what I call the four-pronged strategy. It's kind of like sitting on a chair or on a stool. It requires four legs in order for it to stand up and be effective. And this is the same thing when it comes to memory loss. So the first one is to emphasize the strategies for healthy aging that we just talked about. Just because someone is starting to lose memory does not mean that they can just stop exercising and stop eating healthy because khalas, the damage has happened. That is actually quite harmful. And in fact, we want to re-emphasize healthy habits for these patients and for these people, even after the onset of memory changes. The second thing, which I think is really, really important, is to seek early medical attention. What I'm frustrated by and what I'm really sad about is we are not able to get patients to come and see us early. And the earlier we find the problem, the more we are able to treat this problem. And so this is true essentially for most, if not all, problems in the world. And that is no exception with memory loss. So if you notice, or if you notice a loved one with the beginning early signs of memory loss, it really is no question that you should make an appointment and go see someone in the memory clinic or in your general practitioner's office as soon as possible in order to begin the process of the diagnosis and the treatment. And so when this happens, and when you do achieve a proper diagnosis, and we will talk about this in a second, there are non-pharmacological techniques that we can use to help improve our memory and our performance. And there are pharmacological treatments that we can use to approach memory loss and to try to treat memory loss. And we will talk about these generically, but I'll be happy to answer detailed questions about them at the end of the talk. So what are some of the non-pharmacological techniques? So what I want to do is I want to focus on the bottom two, because I think we discussed this, and this is obviously very important. So when it comes to the non-pharmacological techniques, what are some things that we can do to help improve our memory? These work at any level of memory, but they're extremely important to employ in patients who have already started to have memory loss, because we are trying to help them regain or improve some of their memory. The first thing is improve attention. So if people are not paying attention to a particular thing, they're not going to remember it in the future because they just did not register the information in the first place. So it's so important to emphasize attention. Now, when people studied attention, they found that the magic number is about 8 seconds. So if you spend about 8 seconds paying attention to something, you're actually much, much more likely to register it and remember it compared to someone that spends less than 8 seconds. So please mention this number and discuss it with people and say, we really want you to try to spend about 8 to 10 seconds paying attention to this particular thing, and you're much more likely to remember it in the future. The second thing is rehearsal and repetition. So if we do things multiple times, we say them multiple times, we're more likely to remember. This is important when we're trying to introduce any new change to a patient's life. For example, let's say an elderly person moves from their house that they have lived in for 70 years into a new place. This can be very disorienting. Sometimes it happens because they move to a new house. Sometimes it happens because they go to a nursing home, and they very commonly get lost and they don't know how to get to the bathroom. So it's very important during the daytime, get them to practice, get them to get up and go to the bathroom multiple times and have them relearn the new location. And this is true for everything. For any skill or any technique that we do, rehearsal and repetition is vital in order for us to improve our memory. The third situation can be to use manageable chunks. So dividing the information that we need to learn or that we need to describe into smaller, more digestible pieces of information rather than multiple things. If you or anyone has been exposed to patients with memory loss, you will really see that there is a lot that changes in their lives. All of a sudden, they have to be on new medicines, they have to wake up at a new time, they may have to go to a nursing home, or they may have to move in with a family member. Their whole tempo of life is different. They have to learn all of these new things, and just explaining everything all at once is really not the best way to do it. But breaking down things, learning things slowly, maybe for the first week, talking about the first medicine that they have to take, and then the second week, talking about the second medicine, using manageable chunks of information helps them remember much better than if you just give them everything all at once. The fourth thing is to use memory cues. So this is actually very common when people are studying, particularly if they're studying medicine. They use things like mnemonics or associations. And even though this is less commonly utilized outside of studying, it actually helps a lot no matter what you're studying. Some people come up with mnemonics to be able to use the shower and remember to wash the whole body so that there is no area which is left to be exposed to infection. There are many, many things that we can do to help patients remember some of the things that they need to do. And the last one is organization. Organization always beats poor memory. And, I do this when I go grocery shopping or something. Make a checklist. We will forget stuff. And this is often normal, but it obviously impacts patients who have more memory loss. So checklists, taking notes, using pill boxes when patients are on multiple medications, writing their doctor's appointments in an appointment book. All of these things are very, very important and very, very helpful. It's not enough for a patient just to get a message on their phone saying they have to come to the cardiologist at 10 p.m. or 10 a.m. I think having a clear memory appointment book that they can always go to and always check is going to be something super helpful. So this is the non-medicinal approach to improving memory. When it comes to medical treatment, again, I want to emphasize it is very, very important to seek early medical attention. The more you delay seeking attention, the more likely you are to receive a less optimal result when it comes to treatment. So what is your doctor going to do? Why is it so important to seek medical attention? Most importantly, it's to try to understand if there is a cause which is underlying this memory loss and treating this particular cause, because that can actually completely reverse and cure the memory loss which is happening to these patients. There are things like vitamin deficiency, like B12, for example, infections, brain bleeding or injury, like developing a subdural hematoma. People who have thyroid disease can develop memory loss, and people who have depression, just simple depression, can actually develop into what we call a fake dementia or a pseudo dementia, where patients look like they have memory loss, but actually it's an impact of their depression. So when you do come and see us, our testing is going to focus not just on your diagnosis, but on also understanding if there is an underlying cause, particularly a reversible cause for the memory loss. If all of these are addressed and all of these are treated and you continue to have a memory issue, or your loved one or your relative or a family member, then there are actually multiple options that are now available, both in oral and IV form, that have been shown to slow down memory decline. We unfortunately do not have medications that cure dementia, and we do not have medications that effectively reverse memory changes, but we do have medications that will slow down memory decline and really give patients time to improve their quality of life. And finally, what is the most effective thing is utilizing a multidisciplinary approach. So it's not just the doctor that's going to work with you. It's doctors, nurses who may help you actually learn how to use pill boxes or administer medications to yourself, or teach your loved one how to give you an insulin shot, for instance. Neuropsychologists who are very helpful in diagnosing and treating depression, understanding where the problems in the brain are. Social workers who are able to help you and your families get resources and support, particularly if you have an unpaid healthcare provider or someone who is a provider of care at home for you. Physical therapists will help you overcome any issues when it comes to mobility. Occupational therapists will help you overcome things that require fine motor movement or tasks like showering or cooking, or transfers from bed to a chair. And speech therapists, if you have problems with speaking, expressing yourself, or even swallowing. So as you can see, it really takes a village to help patients improve. And coming to medical attention is your quickest way of obtaining all of these resources that you could need. So let's wrap up, and I'll be happy to take questions right after. Memory loss really is a very serious and unfortunately increasing issue, which affects populations all across the world. And it results both in significant disability and unfortunately in death. So the way to do this is to approach healthy aging and mind wellness with a proactive outlook, a proactive approach, and begin as early in life as possible. And you should focus on not just brain health, but also body health and mental health in order to really achieve the best possible outcomes. And finally, recognizing memory loss is very, very essential. Please come to medical attention early, and we will work together to use both non-medicinal in addition to medicinal treatments in order for us to be able to help you. So with that, thank you very much, and I look forward to your questions.
Great. Thank you very much, Dr. Jerdi, for that wonderful presentation. So if you don't mind to stop share so we can, just start with the Q&A.
Absolutely.
Thank you.
Thank you, Dr. Chi.
Great. Thank you very much. So we have some questions coming in, so I will begin. So Dr. Jerdi, great presentation. I think a lot of insights and a lot of sometimes what misconceptions people have. You've helped clarify those, and maybe we'll help reiterate some of that, as key messages, so people can sort of take that home with them. So
Absolutely.
is there any specific age where we start seeing some of this decline more, or do you see it across board? Or if you could just talk a little bit about that, just so, I mean,
Absolutely.
of course, so if you can give us a little bit more insight on that.
Absolutely, absolutely. So thank you, Dr. Chima. I think it's a very important question, actually, and very commonly asked. I intentionally left it out of the slides because I want people to always be paying attention to it. But
Sure.
in truth, it's quite rare to see this happening before the age of 65. It can happen, but it is less common. Generally, we start seeing a lot of these changes begin at the age of 65. And
Okay.
we know that approximately about a tenth or an eighth of patients above 65 have memory issues. By the time they become 85, about half of them do. So the older you are, the more common it is, but it tends to happen about 65.
Okay, great. So thank you for explaining that about the age. So can you talk a little bit about, of course, you spoke about exercise and to look after your health also in general. Is there any specific exercise that people could be doing which could help really with memory preservation?
What an excellent question. That's an absolutely excellent question. So the way I think a lot of us think about exercise is either aerobic exercise or resistance training.
Right.
we tend to think of aerobic exercise in this case as the one which is much more beneficial.
Okay,
Resistance training is very good for other things, like, for
sure.
example, bone density or weight loss or improving metabolism. But aerobic exercise tends to be very good for cardiovascular health and for brain health. Of course, some people refer to it as cardio. And so
Sure.
it should also be called the braino because it also
Brain.
helps
Okay.
the brain in addition to.
Right, right. Okay, that's good to know. That maybe, doing a little bit more of cardio, aerobic exercise is more beneficial
Absolutely.
for brain health.
Absolutely.
Okay.
Running, cycling, swimming, just walking. I think that the recommendation, if we want to use a dose of exercise, which is an interesting concept, is
Great.
about 150 minutes of
100.
moderate exercise per week
Yes.
is what we talk
Sure.
about. And if
Mhm.
someone is unable to perform moderate exercise, then we double the amount. We say 300 minutes of just low intensity exercise, like
Okay.
walking.
Sure. Okay, great. Sounds good. Let's talk a little bit about, because there are questions coming in about food and nutrition and supplements. So a lot of people want to try and avoid pharmacological medication,
Absolutely.
treat medical
Absolutely.
treatments if they can. Of course, we are
Absolutely.
not here saying that if you need them, that you don't need to take them, but people do tend to want to learn more about, okay, are there any specific foods, like somebody has mentioned, do nuts help? We've heard from our older grandparents maybe that you eat 7 almonds a day and your memory is going to last you well throughout your life and things are. So is there any evidence to that? And also supplements. So there is a mention somebody has done about magnesium, and specifically magnesium lithionate. I don't know if there is evidence to it, but maybe you can talk a little bit about food and supplements, please.
Absolutely, absolutely. Also, fantastic question. So perhaps we can begin with food, and then we can move on
Sure.
to supplements. So we the there is a lot of hearsay when it comes to food, and it's
Mhm.
exactly like you said. Eat almonds or walnuts tend to look like the brain, so if you eat them, maybe the brain will get better. The truth is, none of them are harmful, but none of them have been shown to be helpful in and of themselves. I
Right.
encourage you to use all of them. I think
Mhm.
having a balanced diet, which includes a lot of these nuts and legumes, is actually super helpful. But I cannot, in good conscience, identify one particular thing that you should eat more
Yes.
of all of a sudden. It really is, like everything else in the world, it's about balance. So the more
Right. Right.
balanced your diet is, the better,
Mhm.
and avoiding processed foods or
Sure.
foods that are typically artificially sweetened or things like this. All of these things, the less you consume of, the better. I think that's the
Oh,
general principle, and it
yeah.
applies here very. Um,
100%.
the topic of supplements is a very interesting topic. So actually, there's a lot of supplements that are marketed specifically for memory improvement. Think one of them
Okay.
is magnesium, and the other is like herbs like ginkgo biloba. There are so many different ones that have
Yes.
been marketed. Um, there has not been a single study to
Sure.
convincingly demonstrate improvement. And unfortunately, some of them can actually cause harm. So some of the herbs that have been marketed for memory loss have been associated with significant risk of brain bleeding. And so I recommend against using supplements for the improvement of memory. And I
Sure.
think it's very clear that if you eat a healthy, balanced diet, you do not need to supplement it with anything. The only time a supplement is appropriate is if someone has a vitamin deficiency that they are trying to correct using a
Right.
supplement. But otherwise, I generally discourage my patients from using those.
Sure. 100%. Thank you very much. So again, that's the answer for a few people that did ask questions specifically about supplements, and we did have questions on food, so nuts, and somebody mentioned berries, and you know how some diets become popular, and it's the marketing on the social media. It's very confusing for people, for consumers out there, right? You know this, I know this. If you just look up something, it gives you hundreds of pages. You don't really know what's right, what's not. And then you just start following something, and then of course we have bloggers and influencers on social media. So I think we just need to be mindful of what they're saying and whether there is any really evidence base to it and who is really funding, those sponsored
Absolutely.
kind of ads, right?
Absolutely. There's a lot of background interests, and I think,
Yes,
the rule of thumb is if it grows naturally from the ground or from the trees, it's
100%.
probably the best thing for you to eat.
Yes, I agree. So if grown from the environment, eat it. If it's grown in a plant like an industry, maybe like you said, avoid
Probably
it.
not.
That's
That,
processed, right?
that's exactly right.
Uh,
That's
okay. So let's talk a little bit about technology. Of course, technology is now, everywhere. It's part of all our lives. Is there anything like in technology aids that we can use, that can help with memory preservation?
I think that is a fantastic question because what we see in our clinics is
Mhm.
many people come and say, "Oh, there is this program. It does these exercises, and you subscribe for a certain number of days or months or weeks and so on." And so there is probably an exponentially increasing number of these things. So I want to take a pause and maybe separate some of the things. So there
Okay.
are definitely programs that focus on improving memory by helping people exercise and do certain tasks. So
Okay.
they give them crosswords or puzzles or something. These have actually been studied extensively because they've been around for some time.
Okay.
And we know that some of these programs do work, but they
Sure.
only work for the exercise that they train you to do. So
Mhm.
if a program shows you a puzzle and teaches you how to do puzzles, you'll become very good at doing puzzles. It's not
Okay.
going to improve your memory. So
Okay.
I think identifying what the goal of the person is. If a person is someone who was doing a lot of math and is really interested in continuing to manage their finances, it's great for them to do math exercises, but it's not going to improve their overall memory. I also want to stress that a lot of this stuff should be free and available, and really thinking about paying for something is valid before you subscribe to anything.
Right.
Um,
Right.
Separately, there is technology to try to help people adapt. So now there is a lot of virtual reality, there is a lot of artificial intelligence, there's a lot of technology which is being implanted in people's brain or in people's bodies to try to help them stand and get up. The scope of benefit is still very unclear because it's all new, but
Yes.
we are mostly using this stuff for task-specific rehabilitation. So if someone is having a hard time eating, there is technology to help them eat. Or if someone is having a hard time communicating, there is some technology to help them communicate. But the truth is, we have not seen any real promise just yet that it's overall improving their memory function.
Okay. Okay. Great. So maybe coming down to a last couple of questions. So
Sure.
does meditation or some exercises like yoga, do they have a specific role in helping with memory preservation?
Great, great question. So, yoga specifically is one of the things that we get asked about. Yoga seems to be quite beneficial to the person, particularly with their mental health in addition to their physical health. So, yoga probably decreases stress and it probably improves some of the physical ability. So, it can help memory through those things, but
Mhm.
you don't necessarily need to do yoga as long as you're focusing on those things. So, yoga is great. If you enjoy doing it, please do. If you don't, because my concern is you tell people, oh, you should do yoga, and then if they don't like it,
Right.
they just don't do anything.
Yes,
As long as you
absolutely.
improve your memory through,
Sure.
improving your mental health and physical, you can do it through yoga, through walking, through meditation, whatever it is you like to do it.
Right.
There's nothing special about one particular activity. It's the end result of the activity that I think we focus on. Medications are very interesting. So we do have medicines that have actually been around for a very, very long time. And
Okay.
these medicines do indeed slow down memory decline. They don't stop it, they do not reverse it, and they certainly don't cure it. But they are meaningful because instead of somebody becoming disabled and not being able to perform activities of daily living in 2 years, that can become 5 years or 7 years. And so
Right.
there is a place for them. And I think you should use them in consultation with your physician, and you should have realistic expectations, but they do help. There are newer medications. These medications are now being made in IV form, so it's a little bit strange. They are new. The benefit of them long term has not been as clear because they are new, but it's exciting to know that there is research to try to develop new things. There's even research looking into developing a vaccine for Alzheimer's disease. So a lot of stuff which is happening kind of in the background. It gets media attention, then it disappears for a while and so on. But there's a lot going on, and hopefully some promising stuff.
Great. So just one last question, maybe if you can give some advice, especially if people have, elderly or older people living with them, like, you referred to older parents, if you have grandparents and who are going through what advice would you give to the caregivers? Sometimes it becomes challenging for them, or they don't know
Yes.
how to address these issues, or they just feel the person is being difficult. So what
Yes.
advice can you please give, to the caregivers so that maybe we become a little bit more sympathetic and empathetic, towards people who are really going through this problem?
I think this is a lovely thing to kind of focus with wrapping up on. So um, one of the reasons why, allow me to give a slightly winded answer, but one
Sure,
of the
sure.
reasons
Please
why
do.
I went into the field of neurology is because unlike other diseases of medicine that are very serious,
Right.
um, neurology affects who we are as people. And so you may be the same person and have a heart attack, or you may be the same person with chronic kidney disease. But the moment you have a brain disease, you're no longer really who you are. It really gets at the fabric of who we are as people. And so I think reminding ourselves that, this isn't my mother in her full capacity. This is her mother,
Right.
my mother with robbed away abilities. And she's
Yes.
acting because of the illness, not because of who she is. These are not her
Right.
values. This is not her love for me. This isn't her love for herself. These are decisions that are impacted. So it's obviously very challenging to do this over and over again, but it's very important to always remember this isn't them in their normal state. Um,
Right.
I want to emphasize that when we see caregiver burnout, we
Mhm.
become very concerned about the patient and the caregiver
Right.
because caregiver burnout has been associated with the risk of death for the patients.
Mhm.
And so one of my advice is not just to remind yourself that, they're going to be hard, but actually take the time to
Sure.
focus on your own burnout, on your own health in order to be able to continue to support them because it really is a marathon, not a race. And it's a
Yes.
very, very long marathon. And when you come to medical attention, speak up and say, I need resources. I need help. This is challenging. I'm not able to perform my job properly. So always use the team and don't take this as a personal sport. It's not.
Yes. Thank you so much. That was really an excellent answer, and I think it must have resonated with a lot of people. And hopefully, this session will be beneficial. Of course, the population is aging, so we are definitely going to be seeing, more of this. So I think people really need to be aware of all these points, and I think you made a very important point about recognizing what normal aging is and what normal aging is not. So, and what is part of that process. So that's extremely important for us to recognize, even for our own self-care. So at that point, I think we are ready to end today's session. And I would like to thank you, Dr. Jerdi, for taking time out from your very busy schedule. We're very, very thankful to you and appreciative. Thank you very much.
Thank you.
Uh,
Thank you for
we
having me.
are also very grateful to all our participants, who've joined us today from different parts of the world for this session. And we look forward to seeing everybody at our next session in May. And we'll have Dr. Caitlin Huckle. She's going to be talking about menopause, which again is a very important issue about which we need to be raising, awareness.
Absolutely.
So wishing everybody who is celebrating Ramadan and, fasting, for them to have a very good Ramadan. It's about to finish, and let's focus on getting all the blessings of Ramadan. And we pray for everybody's else and peace and security in the region and elsewhere. So thank you to everyone for joining us today. And Eid Mubarak to all our viewers who would be celebrating Eid, to all your friends and families. So thank you so much. And we look forward to seeing you at the May iteration, inshallah. And the topic is going to be menopause. Thank you again, Dr. Al-Jerdi. Thank you so much.
Thank you, Dr. Chima. Thank you, everyone. Have a blessed day. Thank you.
Bye-bye.